Hi there, this is my pocket guide for spring semester 2024 for NU 665. First, we start with week 1, which has gastrointestinal disorders and hepatitis, and I went through different quadrants and where the different organs were for reference. And then I went through different disorders that include cholecystitis, appendicitis, and ruptured aortic aneurysm, peptic ulcer disease, H. pylori, IBS, GERD and treatment, pancreatitis, diverticulitis, Crohn's disease, ulcerative colitis. All these diseases I went through signs, symptoms, treatments, and indications, as well as diagnostic tests. And then we went through hepatitis, and I included that in my clinical reference guide, and went through the different types of antigens and antibodies and what is IgM and IgG and how to be able to interpret these in clinical practice. And then I went through the different types of Hep B signs, symptoms, and treatment. Hep C is here. Hep D is here. And then I included hepatitis labs. And then now we're into STIs like and sexually transmitted diseases such as vaginitis, and I concluded the signs, symptoms, risk factors for that and the treatment plan. And then we went on to common gynecological issues, which was week 2, and I started in with uterine fibroids and included a picture here of where fibroids are and their subtypes, so I can be able to use that as a clinical reference. I went through the symptoms, diagnostics, pharmaceuticals, and then we moved on to fibroids specific to pregnancy. I concluded useful links up here in order to be able to look at fibroids, commonly asked questions and facts. And then I went through endometriosis, which is very extensive, and I concluded the pathogenesis based off of clinical features article and the book provided, and went through the risk factors, diagnostics, types of endometriosis, such as the stages and how we typically diagnose this, as well as medication treatments. And then I provided links below to routine screenings and treatment plans that include up-to-date below. And then I went on to go over ovarian cysts and the type of ovarian cysts and when they occur. And then I did a picture here from a reference from myself and the types of different cysts, the symptoms, how they're diagnosed, and basically how we treat them. And then I went through the same thing with adnexal masses. And then we moved on to week 3, which was heat, and I didn't include everything from this particular section, but I did include things that I felt were going to come up in clinical practice. Scleritis, conjunctivitis, open angle glaucoma, closed angle glaucoma, cataracts, and the routine screening and treatment guidelines here. Acute sinusitis, acute bacterial sinusitis, acute pharyngitis, and a standard treatment plan. Otis media, otis externa, sinusitis. And then we moved on to week 6, which was GYN oncology, and I included uterine cancer, uterine sarcoma, common presenting symptoms, what we would find in a pap smear that would be indicative of atypical glandular cells, risk factors for uterine sarcomas, how we diagnose these sarcomas, common presenting symptoms. And then I went on to give a standard treatment plan and provide some clinical pearls for myself, as well as staging and the staging of leiomyosarcomas. And then I moved on to talk about endometrial cancer, common presenting symptoms, the way it's typically diagnosed. And then I gave myself some standard screenings for endometrial cancer here with cancer.com, so I'll have these references and specific education points to provide patients. And then ovarian cancer, did some more information about that, most common presenting symptoms, risk factors, how we diagnose these types of cancers, And then I give the same information on fallopian tube cancer, cervical cancer. And then I gave myself some guidelines here, the ASCCP PAP guidelines, which I'm going to be using quite a bit in practice, and then other cervical cancer treatment guidelines here. And then I did cover vulvar cancer and vaginal cancer. And then I moved on to the bottom here was week 7 was infertility. And I kind of explained about infertility, the causes of female infertility, and the different labs associated that we were going to need to draw in practice to assess somebody's egg reserve, and different labs that we would draw here as well to assess somebody's fertility, and then male infertility issues I included as well. And then I went on to week 8, which was vulval vaginal disorders, and vaginismus, vulvar dermatitis, which included the lichen sclerotis, lichen planus, and lichen simplex chronicus. And then I covered some benign gynecological issues that I'm going to be using. This dyspareunia, cervical polyps, adenomyosis. And then I moved on to week 11, breast cancer, where I covered what are the important risk factors for breast cancer, and I reviewed lobular carcinoma in situ and the ductal carcinoma in situ. And then I did prognostic and predictive factors in early non-metastatic breast cancer. And then I went over a human epidermal growth factor receptor 2, so I have information on that. And then I have links here for the detailed prognostic factors for different breast cancers, and I'll have those for reference. And then more information on newly diagnosed non-metastatic breast cancer, as well as HR negative and HR2 negative cancers, as well as HR2 positive cancers, and then the triple negative cancers. And then I included some more risks and some more guidelines and treatments for breast cancer screening. And then I went through atypia and lobular carcinoma in situ. And then the BRCA mutation, I have that. I briefly have this for osteoporosis and rheumatology, just common Felt syndrome symptoms, just to have on hand. And then I went through week 13, which was migraines, anxiety, and depression. And I kind of went through some of the estrogen, or some of the related migraines to be of note and to look at. And then included in my clinical guide, I had headaches with high risk characteristics or red flags, so I have that for when I'm in clinical setting. And then links to routine screenings. I have here the pathways up to date and headache initial evaluations in the emergency department, and the NCBI diagnostic management of migraines in 10 steps. Headaches in pregnant and postpartum women, so I have that, and I can be able to look at that closely when I'm caring for my patients. And then the diagnostic criteria for preeclampsia, as well as up-to-date headaches during pregnancy.